So I stopped worrying about the drugs, and if I could just keep them alive and keep them functioning, then the drugs always seem to work itself out.
Cannabis truly is a pharmacy in a flower.
Survival comes with cooperation.
Pleasure is healing.
You're being a warrior of the weird.
I'm Lex Pelger, Director of Education at CV Sciences, and this is the Lex Files. Dr. Efrem Nulman is a seasoned psychologist who works in harm reduction. Rather than obsessing over curing some particular symptom, his goal is the overall health of the patient. His flexible approach is unorthodox, but as you can hear in the interview, he's not afraid to express his opinions. He knows the history of psychiatry and medications, he's been closely watching the rise of psychedelics, and he's been helping people with their mental balance for decades. So if you want some tips on how to balance your own behaviors, and if you appreciate a fresh perspective on psychological health, then I know you'll enjoy this conversation with Dr. Efrem Nulman. Hello, everybody. I'm very pleased to be here today with Dr. Efrem Nulman. Thank you for joining us.
Hi, good to be here.
So you're a psychologist who also teaches pharmacology. And I wanted to ask in the beginning, what drew you to mental health as the field that you were going to work in?
It was an accident. I was working in 1977 in a group home for what they used to call emotionally disturbed kids. Today, I have no idea what that means, but they were upper teenagers, like 15 through 18. And I was the recreation supervisor. And none of the kids got better. So I just took them out with me to play ball and did all sorts of oddball things. And they started to act like normal. And I said, well, that looks better. How do you do this? And the psychologists, they were very encouraging. They let me do my crazy thing. And they said, well, maybe you should go to school. And that's kind of how I did it, because I wasn't intending. No, I was just looking for a job at first.
And what was the school process like for you, especially now as you look back on it with what you know of the field?
It was great. I went in a time where I had some innovative teachers and innovative thinkers, and I just lucked out. I had a great supervisor in the first clinic that I worked in. He was brilliant. I consider him a teacher who laid my foundation of how I think about things to this day. I just lucked out. I had some bad experiences, but those were great too. I learned a lot. I lucked out. As I went through my career, I had to seek out people like this. It was rare that I could find people of this caliber. I fell into everything. It was pure. I was blessed, incredibly grateful and blessed at the beginning of my career. Yeah.
And what kind of work were you doing in the very beginning as you were getting out of school?
Well, I was still hanging in, always working with college age, basically. Above two, older, obviously the families. I did a lot of family systems therapy, as it was called back in the day. I still believe in a lot of that. That's what I was trained in, doc and postdoctoral work. And so I did a lot of that. But again, it was within the focus of a particular age group. I was very interested in trying to get kids started in their life in the right way. So they're at that age. Could they get a good zip and go? And the reason I became an addiction expert, I don't know what addiction means, but I'm an expert in it. I think the DSM knows what it means. I don't even use that word anymore. So I'm a drug specialist. Well, I don't know what any of that means. But the reason I did that is because young people use drugs. And and I didn't know what to do about that. I was told I had to do something about it. I wasn't sure what that meant. And they told me there was AA and rehab. And I don't know. Then the people that seemed to go and need it didn't get better. So whatever, I could get into the theories and all that stuff later. But early on, I didn't know what was doing. So all I tried to do was look into how could I keep people alive. I was scared to have somebody get hurt. I was a selfish son of a gun, like most people. I didn't want anything to happen to my career. So, a lot of people do think about that. So I'm laying it bare. It was ugly, but that, you could destroy everything, right? So I was scared. I was scared a little bit for them too. I did care after all. And I didn't know what to do. So it was about keeping them alive. And then I wanted them to have decent lives, get jobs, have girlfriends, boyfriends, do the stuff that we all do, social life, all the stuff you do growing up, all of, as we now call developmental tasks, right? So you got to keep them functioning. So I stopped worrying about the drugs. And if I could just keep them alive and keep them functioning, then the drugs always seem to work itself out. They'd either stop or moderate or choose a safer drug instead of a more dangerous drug. I started to subsidize. I said, hey, why don't you do this instead of that? I found that, lady, you're not supposed to say those things. Now I say them, well, now I'm half retired, so I say anything I want again. But I said it throughout. I always said, when I worked in a college, I substituted binge drinking by encouraging people to smoke pot. Now, I can't say anybody was going to love me for that, but heck, I was the senior dean for the place. I did whatever I wanted, and nobody bugged me.
And it's funny because even today on your email list of articles, you were talking about how with drug use, most people grow out of it. As much as we worry about drug use in the developing brain, most people just stop.
Which is what I used to tell the parents of a lot of college kids through the years. I always said to them, look, your kid's probably going to either stop or they're going to moderate. So, but they'll get it together.
And when we first started talking, you had an interesting angle. I mean, you'd be around the cannabis and psychedelic community talking about how cannabis can be a problem, especially for young people, and how it can be addictive. And so many of these pro camps will never believe that's true, even in any case. And so I was wondering how you walk that line with college kids and harm reduction around cannabis use specifically.
Well, first of all of it's under the rubric of an emphasis that suggests that all drugs are the same. They're good and they're bad. And that's how I approach it. I don't distinguish, so I talk to young people about this stuff very honestly. And if they were messing up, if they were having a bad time in their lives, again, it was about getting their lives in order. If they got their lives in order, then you calculate what their drug lives could look like if they want to continue. So, if you have a kid who's smoking pot 24 hours a day, failing in school, once there was a relationship and I could say things straight, which is why you got to get a relationship quickly so you can talk straight to people. And you could just say to them without all the theories and stuff, if you want to smoke pot, I'm not against it, but do you think it's succeeding? That's motivational interviewing. Do you think it's working for you? Well, don't ask me that because you're suggesting that I should stop. No, I'm not asking you to stop at all. I'm asking and I always say, sometimes they correct me and I have to remember and say, I asked it incorrectly. I should have asked you, is it working the way you're doing it, or could there be a better way to be doing this? And do you want me to help you do it better is the follow-up question. And that's when they're willing to play.
You must have been so good at this, I have to say.
It's fun.
I feel like I would have been lucky to have you when I was back in those days.
Well, it's fun, and I used to have parents sometimes would say things to me like, "You're encouraging him to smoke pot or to use pot." I say, "All right, he refuses to stop. We've had this discussion, okay?" And the kid would sit there during this period. I'm not stopping, and I'd say to parents, if you have a better way, and I could show you evidence to what I'm doing. If you have evidence that you have a better way to do it than I'm doing it, and he buys it and doesn't buy mine, I'll join your team. I said, show me a better way to do this work. Talk to other people. I'll take on anybody. I'm willing to be wrong. They couldn't do that. They were desperate. They were hurting. And they said, all right. And I said, you're going to be happier with this because eventually he's going to get it together. And he's a good student. A lot of these kids were really smart kids. So I said, he's going to end up in medical school. He's going to be taking care of me one day. So I said, I have a reason to want him to succeed. They'd always chill out when I said things like that because they saw it was about functionality. They wanted him in med school. Oh, he's not going to get in med school. Don't worry, he's going to get in med school. because I want a good chemist in med school.
And that's a good segue to one of your other important areas is of chemistry and the history of medications in psychiatric health. And I was wondering if you could give a little rundown in how psychiatrists got to where they are today with how drugs are being used.
Well, it's really simple. Watch how quick we do this. I'll do it out of order. So let's start with opiates. That's what we treat mental health with. That was the beginning. Medicine. Well, what happened? What went wrong with that? Oh, it's addictive. All right, let's try, I'm going out of order, barbiturates. Well, it's addictive. We have to put a stop to that, especially in a country like America, which is so darn prudish because we're so excellent at everything, he says facetiously. And let's go to amphetamines. Well, that's worked out a bit, but they're addictive. So let's get off of that. Now we found the magic bullet, SSRIs. Okay, so, 40 years ago, come along, Prozac, and then we invent a whole bunch of them that are all the same by different names. Then we reinvent them, call them by third names, fourth names. You wouldn't believe. You have to look at the ingredients. You keep seeing the same thing reconnoitered over and over again. So now we're up to that. You have physicians who are functioning and psychiatrists who are functioning. They learn this in school, and this is what they continue to do. If we read Irving Kirsch's series of articles in the New England Journal of Medicine, we have a preliminary understanding that SSRIs, antidepressants as they're known, albeit that they're given to 12% of the population in the United States, that they work as well as sugar pills. And a third of the studies demonstrating these outcomes were hidden by the pharmaceutical companies and the doctors involved in this work. This is really a crime. I could go into hours. I'm not going to bore you with the articles about side effects, and people know about the black box warning related to suicide in young people. That's the tip of the iceberg. If we read material by Andrew Nierenberg in Harvard, we learn that people are, at best, even when it works, they gain symptom relief. But that's not what people want. They want their lives back. They want to feel something. And they don't want to take these medicines and lose their ability to have sex. That doesn't add to the quality of their lives. Or they don't want to gain weight. That doesn't add to the quality of their lives. Or they don't want to have their legs shake at night, or their anxiety get worse, or wait 4 to 6 weeks for these pills to see if they kick in and then be told, well, give it another 2 more weeks. It gets really good. Or just not work at all at best and stay on them. Or let's talk about addiction. Yeah, these are a bitch, you'll excuse me, to get off. And I've hospitalized people who got off without titrating the medication down. And if you're on for years, for some people, it takes a while to get off them. They're awfully addictive drugs, and they have significant withdrawal. So anybody who says they're so safe, they're out of their minds, and they're factually wrong.
And the hard part is, it is simply the way things get done now. It doesn't seem like there's many other options. What would you like to see instead of SSRIs from a young mental health professional getting into the field?
Well, we have a crisis in psychiatry. I've spent the pandemic over the last year, and over the last years, I've interacted with primarily medical students and medical residents in psychiatry programs. And I taught in 3 different programs briefly this past year. And what's clear is what they learn that everything is biological, and they don't even know what that means, by the way. And therefore, we give medicine for everything. And they don't learn, whether I'm critical or not of other therapies, there are value to them, just like there's value to pharmacology in the right time, in the right way, in the right place. Same goes for therapies, but for each individual differently. But they don't teach any of that stuff. So let me give you a quick case example. I'm working with a group of residents. They describe a case, and in a nutshell, they describe a woman who suffers from borderline personality disorder. I'm no expert in borderline personality disorder, but one of the things I do have to know is I have to know what works for such folks, because I can't treat them, but I have to know, where do I refer them, right? So what works? So what they did was they started to give her medication. I go, why'd you give that medication? Because she's doing this, and that. I go, but you said she has a borderline personality, so don't you want to treat that? Yes, they want to treat that. So why are you giving the medication? What does the science say? I asked them. Silence. And I played this out and tested it with a couple other places just for the fun of it. Silence. So the answer is dialectical behavioral therapy, DBT, something I know about theoretically in a deeper way from way back, but I couldn't do that. But I know where the programs are. I know where to send people. I know where to look. I know what type of therapist to look for. I know I'm in trouble. If I don't know something, I get a little nervous. I want the people to get better, and I don't have the skills. So I better get them to someone good. And I have an obligation to follow the science and common sense. So what do you do when it comes to addiction? I met most of the people who work at Bellevue, who wrote the textbooks on addiction. They all work in Bellevue, and their notion of drug users are the people who end up in Bellevue. If anybody in the United States or across the world, they know about Bellevue. Bellevue's for the sickest patients. Bellevue is not your average drug user. Far from it. It's a lot of homeless people. Most people are not homeless. Now, I'm not saying we shouldn't treat those folks and come up with methodologies, but you're not going to put the average pot smoker into a treatment center, though I've seen some of that craziness too from people, an attempt to do that. So there are different ways. So what do? There are all sorts of ways to treat people on an outpatient basis when you don't need inpatient. There are a series of therapies: cognitive behavioral, dialectical behavioral, family therapy. These are evidence. If you look at the Canada equivalent to the to NIDA, to the National Institute of Drug Abuse in America, in the equivalent group in Canada. In America, it took years to get alternative therapies, meaning just regular therapies like family therapy, listed as an evidence-based therapy. In Canada, they were much quicker to have these listed and to really go at it as to what works. So whether it's intense exercise, which is a very effective mental health treatment, whether it's nutritional approaches, there are medications within pharmacology that work for PTSD. Okay, we're not even up to psychedelics yet, which have a great track record. We're talking about stuff that's legal, ready to go today. There are medications that are very effective. There are anti-anxiety medications that we need to know how to use. So I could go on and on with ways to treat. There are a million ways to treat. We could treat depressed people to exercise every hour when they just go out of bed and do push-ups for 5 minutes every hour. And since they don't sleep, they're up for 16 hours. They'll be in great shape at the end of each day. Couple of months will be an awesome. I've worked with people and we've done this.
That's a great line I've heard from you, that doctors often say follow the evidence, but the evidence often says exercise and diet, but they still just prescribe SSRIs instead.
Right.
You mentioned cannabis and psychedelics and drugs like that. How would you like to see those rolled out? People have been hearing about them, but there's a trickiness of who's going to be giving them, in what kind of settings. What would you like most to see?
Well, again, I want to see safety and functionality. I haven't changed much in 43 years. The same basic principles. Most of the work that needs to be focused on in psychedelics is what you do before and what you do after you take the psychedelic. Because you take the psychedelic, it's 6 to, some people say 12 LSD hours. I don't buy that, but all right, roughly an 8 hour, 6 to 8 hour experience if you're doing a high dose psychedelic, which we're talking about, because that's where most of the research is in terms of what was effective. So you're talking about a high dose psychedelic, 6 to 8 hours. You got the rest of your life after that. And you might as well start focusing on it before. So I'm a big fan of following a lot of the protocols that are available in the current research, putting on eye shades, having someone there to be a safety person, a sitter. And a sitter is a very specific role. A sitter's role is very simple, or a guide, as it's described by various theoreticians through the years. A guide should follow what Jerry Garcia did. Do nothing. Garcia used to not talk during concerts. He didn't want to interrupt the trajectory of people's trips. So you never heard him say, hello, New York, hello, Connecticut, hello, France. He didn't do these things. So same for the sitter. Help the person to the bathroom. Keep some notes of what they say. So afterwards, you could ask them about it, or just mention to them that they said it. If they get up and take off the eye shade, they want to talk a little bit. Listen to them. More listening than very little talking. There's no agenda. That's the main thing. A guide, a sitter should never have an agenda. They should be mature. It's not about them. Again, it's ego destruction, but on the other side. Destroy your ego before you go in there to sit. It's not about you. It's not about you being a guru, or you being a shaman, or you being a leader that everyone looks up to, or you telling them what drugs or medicines to take, or what the ways of healing are, or watching a movie before, or watching a film before, or putting something in their head. This is all bullshit. It's about the medicine. Let the medicine, it is such powerful medicine. Let the medicine do its work. Sit there, help them. If they get into trouble, then do the stuff that good harm reductionists do. Redirect them to inside, to what they're there for. Redirect them to their intent, but mostly redirect them just to lie down that it's only the medicine. Things are going to be cool. Why don't you take another look at that? It's all easygoing stuff. The less said, the better. So I'd like to see settings that do that. Unfortunately, and where women aren't attacked by these so-called, they're not sitters, they're not guides, by the people, I don't know what they are, who take advantage of people when they're in a vulnerable state. And it's endemic to men. As soon as they get a little power, they feel they got to grope women or say disgusting things, and under the influence, this would be horrific. And it's happening. It's happening all the time.
Hey folks, it's sponsor time. The company is CV Sciences, the product is Plus CBD, and the discount code for 20% off is Lex Files. And remember, the top 3 reasons to use that code on pluscbdoil.com. Number 1, I would give Plus CBD to your grandmother, because I gave it to my grandmother. Number 2, I was the biggest skeptic. Then I started studying the endocannabinoid system. Number 3, I know firsthand that CV Sciences is committed to pure science and to enhancing well-being. So when you find yourself in need of CBD from true agricultural hemp, consider Plus CBD, the number 1 CBD brand in the United States. That coupon code is LexFiles, and the place to use it is pluscbdoil.com. It feels like it's one of the really hard parts, is that most people could probably be pretty good guides, even if they're not mental health professionals, if they're sitting for somebody who is a stable vessel, if you were. But it's so easy for the underground to manifest people who become predators because of this energy that comes out and is somewhat coming through them. It's easy to think that just because you're the conduit, you're also the source. And what are your feelings of the underground practitioners versus the above ground practices that are now coming online?
Well, there are some underground practitioners who are doing some class A work. They're doing unbelievable work. And they're the type of people who need to be organized at the forefront of this work. Most of the work that I have found The safest is in the research community. Let's be frank about it. The research community has done effective work, although if you read an article by Monica Williams as to her experience and the experience of minority women who went to become MAPS therapists and ended up being given MDMA in a way that was horrific. Now, if that's an everyday occurrence, and it's more than a once occurrence, I've heard of it as more than a once occurrence. This was not my hearing; it wasn't unique there. There's when I went to school, we always differentiated between the words cause and function. When you're on a cause, you got fervor. You're ready to do anything to break that wall down. When you have a function, you've matured in the cause. You're ready to take that cause and you're ready to massage it and you're ready to make it into something that stands and that has it's a holy edifice in a sense, but it's the operationalization of that cause. And the function is the ability to do it in, one could use a professional way, or certainly in a way that is at the highest level of ethical behavior. So psychedelics are very much in a cause phase. People are very excited. And part of it relates to the failure of the mental health movement, everything I've talked about till now. The failure of the pharmacology movement, which has become the all-powerful movement in mental health, unfortunately, considering it's based on incorrect thinking. And thinking that's never been proven to be true. It's absurd. But yet people are living this every day, and then they take a psychedelic and suddenly taken wrong and taken right, because the meta-studies show that even people who don't close their eyes and don't sit with God, there are many of them who walk away, most of them walk away safe. The World Health Organization declared that LSD and psilocybin are the two safest drugs in the world before cannabis. Okay? So what am I going to sit here and lie? I just described the ideal way I think it should be done, in a mature, healing way, in a medicinal way rather than a drug way. But the people who do it the drug way, most of them, not all of them, I've seen people who've gotten into real trouble. And anyone who tries to deny that is nuts. But most people end up finding some gain. So they're the ones turning around and saying, why should I go back to a bunch of docs in a hospital or a clinic or a medical setting and start over again? Well, there are still safety issues. The extreme doesn't justify it. The issue of microdosing. We've not looked carefully at the health, and some have claimed there might be issues related to the heart that are unknown because we're not built to take psychedelics that often, even in small doses. But we don't know. That may not be so. But there is a potential one has to consider that even in microdosing, because we've not measured the effects of using psychedelics on a daily basis. Therefore, we don't know if indeed the microdosing affects the heart valves. In fact, Shulgin had heart valve surgery, I think when he was 77, if I'm not mistaken. And nobody could say that's the reason he had it. That would be unfair. But so I shouldn't have said that. But I'm saying it, okay? I mean, leave it in. I'm saying it because it's true. Okay, I'm not making it up. I may have the year wrong, but it's true. So, and do people potentially have this risk? Potentially. We don't know. That's all we could say.
And speaking of the extremes, you're in a great position to ask. For people who are so intrigued by this, because using psychedelics in the underground is now one of the hottest ideas, who in the mental health realm, who should be the most wary of doing psychedelics when it's just a friend sitting for you?
Well, let's do it this way. And I don't know that this will prove to be true in the long run, but it's true based on the way the researchers handle it now. And I'm a little crazier about it. So I get calls occasionally from sitters or from other people, and they'll ask me, what do you think about this? Now, if it's something out of my bailiwick, I'll send it to someone else. But if somebody has a relative who's schizophrenic, and a relative means parents, grandparents, brothers, sisters, cousins, uncles, aunts, Okay, that goes for bipolar folks as well. Is it 100% true 100% of the time? I've called some doctors that I work with who know psychedelics very well, and I've asked them on particular patients who have I call it a low-grade bipolarity, and they've said yes to me about sending them for a psychedelic experience. So I've been shocked, but for the most part, that applies. People who have diabetes or high blood pressure that's uncontrolled, people who have any type of a heart problem that unless they've received authorization from a cardiologist who knows their situation very well. My statement to people is if they're obese, I've always turned people down. I say if you can't run at least 3 miles in 45 minutes, that's a that's a walk basically. If you can't walk 3 miles in 45 minutes to an hour, you probably shouldn't be doing this. If you get out of breath, if you have asthma, you want your doctor to look into it. If you have COPD, if you have any kind of cancer, you want to ask your doctor, even though most people with cancer do fine with it. It depends when. But if you have an extreme medical situation, you want to ask. And there are some you have to know how to handle. Some people have certain illnesses which will look quite serious. And there are also medications that have to be looked at and avoided. By the way, SSRIs are the death of psychedelics, and psychedelics are the death of SSRIs. I'd rather prefer the latter. But they don't interact. They don't get along. All psychiatric meds have to be looked at in terms of how to modify them. Some meds that are given, for example, that are for physical ailments, for example, anti-seizure meds have to be looked at and the effect that they have. Not in a bad way necessarily, you just may need to take them at a different time. So you need people who really know about this stuff from both ends, the psychedelic end and the traditional medical end. Then there are personality types, people who are sitting with a friend. If somebody has severe anxiety, I could go into all the clinical labels of it, or post-traumatic stress, or even severe trauma. Even though those are the perfect candidates to treat, or severe depression, to have your friend do it, maybe, but I don't know. I wouldn't tell somebody to have their friend do it under those circumstances. Again, it could turn out fine, so I'm not going to be a fool and try to say otherwise. But it could possibly turn out badly, and I want the odds to be close to perfect. I want the trip to be great, and that's about set and setting. You want everything to be prepared and as perfect as you could get it, so the person could really, really change their lives in a great way.
So you mentioned cause and function earlier, and one of the hard parts in the psychedelic and plant medicine and cannabis community is how many people are in the cause, are so very fervent about this and don't want to hear any of the negatives that you've been talking about and really don't believe in them. And I know this is something you speak about a lot. Could you share some about the dangers of people glorifying these plant medicines as perfect and harmless?
Yeah, a lot of the too fervent believers, it's becoming an industry. There are integration groups. Everybody's trying to make a buck now. I understand young people want to maximize their ability to do this. They have good intent, many of them. Some don't, but many do. They want to, their hearts are in the right place. But I'm going to quote a brilliant sitter who was also a teacher of mine in the area of psychedelics. I consider him, he's really has great wisdom in this area. And I once asked him, I go, so-and-so, I go, how is it possible? This was early in my understanding of the more theoretical thinking about psychedelics. So I'd say in the last 20 years, I've always been curious. I'm a product of the 60s and 70s, and a lot of people were using psychedelics, and yet the world's kind of, at least in America, things haven't worked out exactly perfectly. We're not the kindest people. We're not the most loving. We don't have a sense of oneness and unity. We're a bunch of bastards, looking to make a buck, and we stomp all over each other. I'm not sure what that has to do with psychedelics. So I asked this fellow, I said, how is this possible? And I said, people I see, after a while, their nature, not their personality, but their very nature, their essence emerges again, even after. And he had a great line. He said to me, my boy, some people are assholes and they take psychedelics, and all that happens is they become psychedelic assholes. And that kind of told the story to me. And that went back to the issue of it's what you do before, it's what you do after. So bad stuff could happen. People could not get better and just keep behaving crazy or keep behaving not nice towards others. That would be the worst outcome if people just can't be nice to one another. That's the bare minimum of our existence, and we can't seem to do it very well.
So just two last questions to bring it back to the mental health world you were talking about in the beginning. What advice would you have for people who just want to do something at home for themselves that's helpful?
So what I try to do is I try to do a couple of things. I do something that's both a diagnostic tool, it's a treatment modality, and it's an in-office kind of test to see what are we really doing here and how should we approach it. Okay, all in one. And it hopefully, potentially will lead to, I'm very lazy, so cognitive behavioral therapy, I can't do it the way it's supposed to be done with boxes and following on this and that. It's too many details. So I came up with the shortcut. Most people don't want to meditate for 20 minutes, a half hour, an hour. They just don't want to do it. So I figured, let's roll it all into one thing that takes 5 minutes or less. You can do it twice a day, and let's see how it works. So it really needs to be tested, and then there's a secondary level to it, but I'll try to do it as quickly as possible. So what I do is, in office, I used to do this. We'll have to develop something new for people to do it on telehealth and things like that. But basically, I lay down 3 books on the floor, and it could be any books. I like them to be different colors and nice, bold titles, things that you may look at and remember something. Okay. So I put the books on the floor, and I tell the person I'm working with, I want you to look at the 3 books, okay? And all I want you to do is memorize the title and what the books look like in your mind's eye, okay? And I give them as long as they want. And you learn a lot about them. Some people right away, some people 5 minutes, some people start getting obsessive. Some people can't remember. They start having ADD. They're going off and they have concentration problems. So right away, for me, I'm getting an add-on to what I heard as a narrative for 45 minutes before. Okay. So assume they now get there and they say, okay, I'm ready. I say, okay, sit comfortably in your chair, and I'll tell them to close their eyes. And I'll tell them to tell me what the 3 books, what they were. So this is this is that, this is this. I say, tell me a little bit about each of them. The first one, what did it look like? The color, this, that. Sometimes I'll tell them, if you don't remember, just open your eyes, take another quick look. Okay, look again. I keep having them go back, look. So it gets into their head. Okay. Then I tell them what I want you to do is I want you to close your eyes, and I want you to choose one of the books and put that book in your mind's eye. And I'll usually say it like this. I'll say, take the book that you'd like to put in your mind's eye and imagine its color, its texture. Are the letters raised? Are they not raised? Are there different color letters? Are there different shapes? Are there different sizes? The name of the book, the feel of the whole thing. And just keep thinking about that stuff over and over again. So you're almost kind of, I know this sounds crazy, you're one with that book. You could say it could say you, and people do it. They're really they take it very seriously. I go, yeah, and I'll be quiet for a while, and then I'll say, you thinking of that book? Do you have that book totally in your head? Is that book the only thing in your head? Well, I'm getting distractions. That's okay. Just say hi to them and let it go by. So, by the way, they don't know they're meditating yet. Okay, so we're doing this whole routine. Okay, then I'll tell them, switch books. And I'll say to them at the count of 3, 1, 2, 3, switch books. Boom. Okay, do you have a book in mind? Not, some people not yet. It's okay, take another look. Okay, take another look. Start thinking about that. Again, the same thing. Mind's eye, texture, color, the whole business. I'll talk it up like there's actually something big going on with the book, which there usually is. There's a lot going on in a book cover, and they put I've seen 99% of people, no matter what ailment they come with, they put themselves into that job. They love, they're doing this, and okay. I've had one or two who couldn't do it, very rare. Then we go to the third book, and then I say, go back to the first book, okay? And I know already 3 minutes have passed. I now say to them, I want you to think about the worst anxiety, the one that brought you here. I want you to totally wrap your mind about it, imagine its shape. In other words, I want them full, and you could see people, or it's your depression, whatever it is, your trauma, whatever the hell they call it, and it came in as, that's what I want them to totally focus on. It's intense. You see them sometimes shaking, there's legs, this, that. Sometimes people have started to cry, then I'll say, okay, stay with it. Don't let it go. And I'll keep it going a little bit. Then I'll say, okay, when I count to 3, I want you to go back to the second book. I'll arbitrarily, boom. Okay. Are you back at the book? Are you back? Yeah, you're back. Tell me about the book. Go to the book. And I'll start the whole thing. The shape, the texture, the colors. Then I'll say, okay, stop the exercise. And I'll say, up. Because in the office, I said, do you realize what you've just done? And they go, what? I said, you decided that what's more important to you than the worst anxiety and fears or trauma, whatever, fill a depression in your life, is some stupid fucking book that's sitting on the floor of my office. I go, that is the nuttiest thing I've ever heard. I said, why don't you go home and do this exercise? Try it once a day, but for no more than 4 minutes. I want them, because I want them eager. I always want them fighting against me to do more and more. That's part of my approach to therapy. I want them to do more and more and more. I'm always encouraging them, but I'm saying, but don't feel you have to do it. But yeah, you could do this, this, and that. In fact, I want you to do this and that, but don't do it yet. So it's like, pull back, let go, pull back. Now, if you read, this is all stolen, these ideas, from many great therapists, but particularly from Milton Erickson, this book called Uncommon Therapy by Jay Haley, who's one of the fathers of the family therapy movement, who writes about Milton Erickson, who was a master of hypnosis. These are actually hypnotic. These are all hypnotic tricks that I stole from there. DBT and a lot of these therapies were all stolen from family systems therapy. They don't acknowledge it. They don't say a word, but I could root it back in each one of them. Theoretically, they're all there. So this stuff moves along with all of that. And what I found people do is, now the ultimate thing is, how do you make this more trippy? Once I get people exercising, and I go to the gym very often with them at this point, and they're doing this exercise with the books, I then have them doing it, saying, I used to do it in my gym because it'd be TVs. I used to do it myself. I practice it. Do it with the TVs when you're with your eyes closed, you're holding on to the treadmill, but you're on an uphill because you're in great shape by now. When you reach that peak of exercise, the highest of high, they're not endorphins. They're related more to the endocannabinoid system. Okay, that's what the high of running is. When you're running at that peak, and when you're also doing that CBT meditative stuff, there's an explosion up there. And the mind, you do that daily, okay? You can't do it daily. It's too intense, okay? That's all your brain. It's all your brain creating a set of drugs for its own mind. And it's tremendous. It's not even the high. It's the ability to realize this is the power that you have in your own mind to decide what you're going to think about. You decide what you think about. And then I tell them, I begin injecting that idea into their daily lives. I get really tense when I'm about to go to sleep. Go back to the books. I get really intense. I'm at work and something really put me in a panic mode. Go back, go to the bathroom when nobody sees you, and just bring 3 books with you and sit on the toilet seat and do it. Wherever you need to.
That's great.
That's one of a million things that people could be creative about that they don't bother to do.
That's fascinating. Thank you for sharing. That'll help me, and I think it'll help some other people out there. And so the last question I wanted to ask is, you do so much teaching of young people in this field. If there are people listening who are either in mental health or think about going into mental health, what would your advice be to them as they're beginning or metamorphosizing?
Yeah, it's hard to say. I had this with some of the groups that I taught. Some of the psychiatrists literally wanted to quit because I said to them, I said, you paid a lot for education and you were ripped off. You didn't learn anything. It's terrible. And the ones that wanted to quit, I told them, you're the ones that should stay automatically. And the rest of you should also. But I tell them, learn everything you're learning and learn it perfectly, because the only way you could refute it. Heck, I learned psychoanalysis for a couple of years because that's what I was taught. And I think it's probably a combination of stuff that's made up and some good stuff. But, it has nothing to do with treatment for the most part and getting people better. A lot of therapies don't. They're just out there for, I don't know what for. But all right, they're very nice, But, I think people should learn all that stuff. I learned all that psychoanalysis because how could I refute it if I don't become an expert in it? I believe you have to learn every theory. So good, you've learned something. You got to learn I had to go out, and I'm not a physician, so I had to have somebody teach me all about these SSRIs. I didn't know any of this stuff, or how to study it, or where to read studies, or how to read studies. I had to learn everything. So go out on your own and learn all that stuff. They're experts. Don't go to conferences. I've never gone to conferences. What do? I find the person who's given the conference. I call them up and say, hey, listen, you have maybe a half hour I could take you out to lunch, whatever it was. And then I get the conference with my personal questions. And everybody's willing to do that because just like me, everybody wants to talk about what they do. And they like to. They want to get it out there. And it's fun. And people are pent up. They want to be able to say what they believe. And you'd be surprised how many people are willing to talk. This already. People like saying this shit, We all think we're big shots. We're experts. We know something. But together we know very little. But if we keep talking, maybe we'll get lucky. So, go out, get experts, learn stuff, learn everything, learn every theory. I used to drive my supervisees crazy because learn everything. What do you mean learn everything? Well, how do you know that the person who comes in only needs this approach? What if they need something else? Are you going to refer everybody out of your practice? You're not going to, because you're going to want to make money. So you might as well learn how to do a bunch of different stuff. Read more than anybody. You could learn stuff on your own. Go to some conferences occasionally, but not too many, And really, there are so many ways to do stuff on your own and be independent. Don't be so afraid. I was a failure in so many ways. My biggest failure was my students. None of them did it the way I did it. I don't think so. Why? They were afraid. They wanted to conform. They wanted to not only make a buck, not only get a promotion. They didn't want to be fired. I was a particular kind of crazy person, and my wife is a very tolerant woman. And I decided, no, I'm going to do what I think my patients, and I heard what they were always saying. I was seeing people who'd seen 12 psychiatrists. I had one guy, I'll give you a quickie, real quick. He was described as the most severe obsessive compulsive person ever. And I was told to see him. He had seen literally, 8, 9 psychiatrists trying to, quote, cure him. What was his problem? As he described it to me, he couldn't stop washing his hands. He'd get up in the morning. How many rinses? I asked him. He'd do about 30 to 50 rinses. How many would he do in the afternoon? He was at work. How many in the evening, when he got home? Okay. And it was a massive amount of hand washing. So I saw that this guy was never going to stop hand washing. So in the Ericksonian notion, I said to him, you know what? When are you doing this? So he told me when, and it turned out in the morning, I go, do you get to work on time? Yeah. You're doing well at work? Yeah. You're getting paid a good salary? Yeah. He happens to have a very good, responsible, good job. What about at work in the middle of the day? Well, I do it during my lunch break. When do you get time to eat? He goes, well, I eat at my desk afterwards. Do they mind? No, they don't mind. Do you have friends? Yeah, I have friends, but I don't have, they kind of shun me because they've heard about this. What happens at night? Oh, yeah, the same thing 30 times. Do you live alone? I live alone. Do you get home on time? Do you do this? See, he's doing all the developmental tasks. He's basically a normal guy who has this craziness. So I looked at him and I said, keep washing your damn hands. If it gets worse and interferes with your life, give me a call and stop going to doctors and psychiatrists. And I got him off the medicines he was on. And that was the end of it. He called me a few years later. He said, yeah, I just wanted to tell you I was fine. I said, yeah, because I didn't treat you. If I treated you, you would have gotten worse, like most people I treat. So, but there's a need to fix, to make everything better. Not everybody needs that. You need to listen to people. You need to hear people's context, what makes sense. And you need to be willing to do stuff. I'm willing to just work out with people. If that makes them better, I'm cool with that. I'll run with them 5 miles a day. I don't care. Whatever it is that works. And that stuff works. And the final, a great piece of advice, read the research. Follow the research. It's not the stuff you learned in school. Nobody in the research is going to tell you. Give them SSRIs. Read the research. It's all there for you for the taking. And if you want to do it right, you could. Don't be so afraid. All right? You could do it incrementally. You don't have to be a lunatic like me. You could do it incrementally, and you could do it in small pieces. And you could stand up for your patients. And you could also tell your patients once in a while when they come in and they bitch about the mental health field, like most of them do who've been around it, tell them they're right. I tell them they're right. They say, I hate psychiatrists. I go, so do I. Who doesn't? Okay. All right. But it's not fair because a lot of these shrinks mean well. A lot of them don't know better. And a lot of them really want to do better, particularly the younger people. They're great people. A lot of the older folks have done well too, but a lot of the really good people are hidden and nobody knows where they are, including me. But they have to be.
That's great advice. Well, thank you so much for sharing today, Effie. It's always good to hear from you.
Likewise. It's great to talk to you, Lex.
All right. So that's it for now, and hopefully we can talk to you again another time.
Be a pleasure.
Thanks for tuning in. To listen to other episodes, check out pluscbdoil.com, listen on all the podcast platforms, or see us on YouTube. Subscribe to the CV Sciences YouTube channel to see each new episode. And if you'd like to buy any of our fine products, use the coupon code Lex Files for 25% off. If you have any questions, compliments, or suggestions, feel free to write me at research@cvsciences.com, and please follow the podcast on Twitter @The Lex Files Show, where I try to keep it fun. If you enjoyed this program, please give us a like on your favorite platform or share a link to your social media. It means a lot to us. The Lex Files is produced by Matt Payne. The YouTube videos are by Brendan Cleek. Thank you to Tina Molnar and Jasmine Morris for the visuals, and the music is by Jake Bradford Sharp. Our sponsor is CV Sciences, makers of America's favorite CBD oil. And I'm Lex Pelger, signing off.